I will be making a short statement in English for those who have difficulty in understanding the Maltese language, so that the measures that we are introducing today are clear to as many people as possible. As you all know, over the last few weeks, we have started to see a rise in patients infected with coronavirus on our islands. The total today of confirmed cases is of 134 cases. We are basing our strategy in increasing as much as we can the healthcare services, and we've done this in Malta, and we are also increasing services on our sister island in Gozo. But we also urge you to participate in the national effort to bring down the demand on our healthcare systems. And we can do this by decreasing as much as possible the spread of the virus within our communities. Today we will be introducing 2 measures to continue to decrease as much as possible the spread of the virus, or to slow as much as possible the spread of the virus within our country. The first of which comes into effect immediately, is that the police are being delegated by the Superintendent of Public Health to disperse gatherings of more than 5 people in public. It is already an offence by law to organize public gatherings, but now we are also giving authority to the police to disperse gatherings of more than 5 people, even if they are spontaneous or not organized. And the police are being asked to make sure that there is a distance of at least 2 meters between people in public. The second set of measures are aimed to protect the most vulnerable section of our community, which are elderly of over 65 years and people suffering from chronic diseases. And we are specifying who these patients with chronic diseases are. And so besides anybody over 65 years of age, we are also asking insulin-dependent diabetics, even if they are under 65 years of age, all patients on biologicals, patients who have been or are on chemotherapy, who are on chemotherapy for cancer or have been on chemotherapy over the last 6 months, patients who are immunosuppressed, including patients who have transplants or are suffering from HIV, patients with renal dialysis, anybody who is pregnant, patients who over the last year have needed an admission into hospital because of respiratory problems, patients who have cardiac problems and who have had an intervention over the last 6 months, patients attending the heart failure clinic in our hospitals, and patients who are on oral steroids. All of these categories, and this will be published in the media shortly, all these categories and patients over 60 and people over 65 years are being asked to remain at home in all occasions. They are only asked to leave home if they have medical appointments or if they have a special disposition by the Superintendent of Public Health. Persons under 65 years or under 63 years, or persons who are in employment and fall within these categories will be asked not to go to work unless they can do work from home. In fact, we are urging anybody who can work from home to work from home. Those who are not able to work from home will be granted special quarantine leave. So we are asking all of these people who fall in any one of these categories, and those of you who might fall into one of the categories will be receiving a letter at home to inform you of this decision. Of course, anybody over 65 knows that he is over 65, so they don't need a letter, but the rest will be receiving letters at home. We urge you to follow these instructions. These are being done to protect, first and foremost, the health of the most vulnerable section of our society, and also to decrease or to slow down as much as possible the spread of coronavirus.